30% of spine cases end up back in surgery. As soon as I lock in this and fuse this portion of the spine, all the vertebrae below it are still moving. All the vertebrae above it are still moving. So now anatomically, I've created a structural stress issue. And what happens inevitably is within a couple of years, most people end up back under the knife, getting another fusion, getting fused in a different vertebrae.
Yep. Ain't that the truth? We hear about statistics of spine surgery all the time that are not favorable. Remember, some of the top surgeons will proudly state that their statistics are that around 30% of their patients will get better, about 30% will be the same, and about 30% will get worse following surgery. These are good statistics. So the failure rate of surgery is right around 30 to 40% in most cases, especially fusion being one of the higher. Surgery does not have good outcomes, but it is pushed prematurely on tons of people. And that is the entire purpose of our program and what we can help you achieve, which is avoiding surgery and actually having a real plan to success, because surgery does not usually correct the actual problem. It is usually covering it up. It is usually a fast, quick fix type approach that most the time is not truly indicated. This is episode 117 of the Low Back Pain Podcast. And I'm your host, Dr. Grant Elliott with RehabFix online low back program. And these are just some of the many statistics that exist regarding spine surgery. And today we're talking about how spine surgery just ain't all cracked up to be what it's meant to be. If you have not joined my private Facebook group yet, you need to do so. It is called RehabFix Low Back Program. And immediately upon joining, you will receive our free step-by-step sciatica guide, one that we have used to help thousands of people across the world recover fully from sciatica. This is literally the same step-by-step process that we take them through during our assessment calls. You can get a clear idea of kind of what's going to help you and what that plan might look like. It is worth thousands, and you will get this for free just by joining the page. And there are other free courses and trainings that I have in there as well. There's tons of information in there. So if you have tons of highly valuable and free information, and you're actually serious about getting better, then you will join my private Facebook group, RehabFix Low Back Program. I'll see you in there. So you want to be out of pain now, and you've been told that surgery will do that. This is a very common way of thinking that pushes people towards surgery faster than most things. They think, hey, I can get out of pain overnight. Maybe it'll cost you $10,000, $15,000, $20,000, $25,000 to do that. But you perceive this to be an immediate change, an immediate reduction in your pain. People are willing to pay that over and over again to attempt to achieve that solution. However, the reality is that just is not the case. Why do most of our minds think this way? The time allocated to the perceived goal is one of the most valuable things to any human. How long will it take me to achieve my goal? If my goal was to lose 100 pounds, 150 pounds, and I knew that focusing on my diet and focusing on my exercise, it would take me maybe 6 to 12 months to achieve my particular fitness goals. I would need to put in everyday work, everyday effort, thinking about it all the time, make the conscious efforts to change my life, or I could just go pay $25,000 for liposuction. Unfortunately, there are far more people that choose the liposuction route than just simply putting in the work and achieving it themselves. Why? Because the perceived value of fast tracking the time is greater, or at least is perceived to be greater, with liposuction. Oh, I can get this goal right now, and I don't have to put in any work, and it's not going to take me 6 to 12 months. All right, I'll pay $25,000 for it. It's the exact same mentality for surgery. Quick interruption. If you're listening to this podcast and you're resonating with the things that I'm saying, and you're finally ready to be pain-free, and you don't have a plan, and you're not sure how to get there, and you're just looking for that guidance, then visit the link in the description or the show notes below
you can schedule a free initial call with my team, and we will actually go over your current regimen, go over what you should be doing, what you should not be doing, and how a better plan might potentially show you how to get to that pain-free state that you've been looking for so that you can get this over with and back to living your life. So if you're ready to finally figure this out, then visit the link below, schedule a call with us. Looking forward to helping you. Back to the show. Most people receive typical standard care in the healthcare system. Most people with back pain go to their general practitioner who is not trained at all in lower back disorders or spine disorders of any kind. They typically refer them to a very generic PT clinic that they have in-house or elsewhere, or they refer them for an image, an x-ray or an MRI, which is usually not indicated at that point in time, which usually causes more complications in regards to the information that they are being provided and their prognosis. So there's more confusion. And then very generic care. They go to PT or they go to chiro. Most people will receive very generic hands-on approaches, such as adjustments or manual therapy or scraping or e-stim, ultrasound, super generic exercises. Hey, go sit on the bike for 10 minutes. Let's do these few core movements that we have everybody do. And then here's this pre-printed packet for lower back exercises that we give every single person that comes in with back pain. Go ahead and take these. See you next week. That is the approach that vast majority of people receive. So you receive this very typical non-helpful care. You say the same thing that most other people do, which is, yeah, it wasn't very helpful. And instead of maybe being aware that there are other alternatives out there, such as my program or anybody else's who provides actual legitimate expert level care, you might not be aware that these options are out there. And you might have this belief that, oh, well, I tried chiro, I tried PT, nothing's going to help me. I want to be out of pain right now. I guess I got to do surgery. And I don't blame you for thinking that. I don't blame you at all. Being in pain sucks. It's terrible being in pain. No one wants to be in pain. I don't blame you at all for having that desire and having that willingness to go under the knife and take that risk because you just want to get out of pain. I don't blame you at all for feeling that way. If you receive inadequate care and you're led to believe that you've tried it all, then yeah, that's going to be how you feel. However, the entire reason I've created this podcast and my social media, I have over 1,000 posts on Instagram. This is my 117th podcast. I make these to hopefully reach people, to grow, to help people realize that they don't need to go under the knife and to not settle for the generic treatment that they're getting all over. Generic, unhelpful, uninvolved, minimally guided treatment. You don't have to settle for that. That is not good care. There is so much better out there, or at least there should be, and it might not be readily accessible in your area. And once again, that is why we work with people all over the world online. We have clients on every single continent. This is what we provide. Surgical rates are not good. Surgery is there for very, very specific and unique circumstances. Yes, some people need surgery. Some people do. We have sent some people to surgery. And guess what? When our program, when my team sends someone to surgery, it is because they 100% absolutely need it, and it is the absolute best recommendation for that person, and they thank us for it. Because they know they've actually exhausted all of their options, and they're actually getting expert level opinion on their situation. We have not sent that many people to surgery. We have not. We've only sent a handful. But now ask me how many people have come to us that were sent to surgery. Hundreds and hundreds of people who were sent to surgery who decided, you know what? I feel like I can avoid this. Came to us, and how many of those hundreds canceled their surgeries? The vast majority, pretty much all of them. Okay, we have canceled hundreds of surgeries. If I had to guess, I'd probably say we've canceled 500 to 600 surgeries at this point. Happily. I am thrilled to be able to say that. So this is because when we take our clients through a process, we know for sure that we have done all of the highest level
the most premium forms of rehab, forms of planning for their disc problem, sciatica problem, or low back problem. We have provided the best, and we have taken them through all the tests, and we are appropriately tracking their symptoms. And we know for sure if we can help them, we know for sure that we're going to give it the best shot. And then if they end up needing something invasive, we know for sure that will be the best possible scenario for them. Because we're doing our due diligence. We're not just saying, oh, go do these glute bridges and sit on the bike for 15 minutes. Oh, didn't help. Guess you need surgery. It's a terrible approach. It's not helpful for anybody. And we hear this every single day. There's a reason they call it back surgery, because you keep coming back. So as Brigham Bowler said from the Joe Rogan podcast in a somewhat laughable tone, these are the statistics behind surgery, and they're not good. And I want you to avoid these at all costs. Unless, of course, it is the absolute right thing for you to do, which is very, very rare. But I want you to avoid this, because I don't want you to be that person who has to go in for another surgery, and then another, and then another. And next thing you know, you're too far gone, and your life will never be the same. It will never be the same after you've gone through multiple rounds. Trust me, we have had clients who have gone through 2, 3, 4, 5, 6, 10 low back surgeries. Trust me, you do not want to go down that path if you can avoid it. If it is not the absolute best thing for you, you do not want to go down that path. Let's make sure we avoid that. Understanding the statistics behind surgery is very important for you to know. And knowing your options is very important for you to know. You need to have education regarding these topics. And as long as you have education and you truly value getting better with long-term approaches, then you can make the best, most wise decision for yourself based on what you're valuing, right? Based on what you value, based on how you want to live for the next 50 years, then you can make the best decision for you. Once again, be sure to join my Facebook group, RehabFix Low Back Program, so you can get additional exclusive content and our free sciatica guide immediately upon joining. And you can look at the additional upcoming content that we're created just for individuals in that page. It is a great way for you to join a community of serious, intentional individuals, and you can get to see some of our clients winning as well, so you can get a real idea of what is possible for you. If you are watching this on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and help reach more individuals who deserve to get results, who feel like they're spinning their tires and getting frustrated in doing so. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.